Do you think what's your elevator pitch for it still being worth it to become a physician? I try to sell people all the time on PA. I think like if you're getting somewhat older, I think that's the way to go. You know, if you're debating if you should do something after paramedic, I spend a lot of time convincing people that PA is the way to go. But what's your pitch for it's still worth it to be a physician?
My one sentence response to that is it's still one of the best jobs in the whole world. I go on to explain why I feel that way. But the reality is, it is. And I find it real sad when I see doctors, whether it's in the emergency room or in other settings, and they just genuinely, strongly try to discourage people from going into medicine. And I always ask myself why. Like, are you that burnt out? Is it that different than what you thought it would be? Or are you just not managing expectations realistically? Mm-hmm. Would that same person be happy in a corporate office job? My guess is they'd probably hate it even more. Mm-hmm. So I still tell people, like, medicine has changed a lot. That can be very frustrating. It's somewhat frustrating for everyone. It can be very frustrating for certain people. Like for me, I'm not a super tech savvy person. So all of these things that are going, and it's not just like electronic medical records, it's just like every little app and notification and electronic thing kind of frustrates me. Mindset, again, like things change, and with change comes new abilities. So you've got to change, but medicine is still wonderful. You're still helping people. I don't care what people say. You are never going to be replaced by an AI chatbot. That may be something that people disagree with, but like there's nothing that can take that away. Your job is not really threatened. It is still rewarding. The landscape of income is different. It's not like a path to riches, but it is a path to comfort and stability. Mm-hmm. And do not underestimate the power of having a lifelong career that offers you comfort, stability, and a level of predictability. Mm-hmm. That can be very, very reassuring. Mm-hmm. My wife and I, like, my career path is medicine. It's predictable to a level. It's comfortable. We can rely on it, but there is a ceiling. Mm-hmm. And I'm fine with that. It offers us this lifestyle, and she is the creative one. She's the business one. She currently is working as a CEO of a large Amazon distribution company, an Amazon accelerator. But with that comes risk. So like it allows her the opportunity to be the dreamer and take the risk. If both of us were like that, we'd be really setting ourselves up for some very, very risky situations. Because if something happened to one or both of our jobs and we've got kids and we've got a lifestyle, that'd be really tough. Yeah. So I mean, medicine, and it's flexible. You can do so many different things. You can work full-time, part-time. You can work 75% time. You can work less than part-time. And you can change that 1 year to the next. Mm-hmm. So there are so, in job portability. How many jobs out there? They're great, but when you finish your training, you go to wherever the job is, because there may not be that many. The more specialized you are, the more rare you are, the harder it's going to be to find a job. So in something like emergency medicine, it's portable. Mm-hmm. I can say, I want to live there, and that's where I'm going to find a job. Or my spouse got this perfect job in this city, and I can find a job in that. You can do that in medicine. And as a physician assistant, it's even better. Yeah. Because you can change fields. So I would not discourage people from not going into medicine. What I would do is encourage them to go into it for the right reasons and to be able to assess their tolerance of the things that are very challenging about that field. Mm-hmm. If you inappropriately assess that, you might be miserable. Yeah. There are certain people that are able to do medicine, but they would be miserable in medicine just because they have they want different things. They value different things in a job. So it's important to understand that. Yeah. Yeah. Especially in the ER. I think if you have this expectation that you're working 9 to 5 banker's hours, Monday through Friday, that could be a rough
thing to realize when you realize I'm going to be working weekends, going to be working late shifts. The shifts are not all going to be the same. I think that's the biggest thing that even new APPs struggle with if they don't have any ER background is the shift work. Being a paramedic before, my hours were all over the place. I worked a ton of hours. So now just working less seems like a huge relief. And I'm like, well, I don't have to work 84 hours a week anymore. Like, who cares that my shifts can be variable and I have to work some weekends? But it seems like a relief versus somebody that comes from a non-ER background and doesn't know what the ER entails. That can be a real wake-up check to realize, oh, I'm going to be working weekends and holidays sometimes.
Yeah, I think you've always got to perform due diligence for anything and know what you're getting yourself into. And also understand that every action has a consequence. Everything. And there are consequences that are good and there are consequences that are bad. So have people thought, what are the consequences of working evenings and weekends and holidays? A lot of them just naturally think about all the bad things. Oh, I'm not there for this. My wife has to take care of the kids when I'm working on the weekend. But what about the good consequences? Because telling you, there's a lot of them. My wife and I, our jobs are both highly demanding. If I worked a 9 to 5, it would be way more challenging to do all of the duties. Mm-hmm. So a positive consequence of this type of work is I will have days off, sometimes multiple days in a row in the middle of a week with no work. The things that can be accomplished during that time, both personally and things that I do for the family or outside interests or side hustles or whatever they may be, and how I can support my wife. And like this week is a very good work week for me. Next week isn't. So I sit down and I look at it with my wife. I'm like, you have the whole week to do whatever you want, to work out when you want, work as late as you want. I'll have the dinner cooked. The kids are going to be taking to soccer practice. You don't have to do anything. And that makes that next weekend when I'm working and I'm not there and she's having fun with the kids, it makes it like, well, I had those days off and there were a lot of benefits to those.
Yeah.
So think about the positive consequences
and
the negative consequences and understand what does that fit your desires, because it doesn't fit everyone's desires.
No, that's a great positive point about ER shift work is like, I have the same thing. Like I have some weeks where I'm off almost every day in the week and my wife can schedule a bunch of stuff. She can get a bunch of things done for herself. I can be there to help with the kids and put them to bed and stuff like that. And then, and then you have the week where it's rough and I have to rely on my wife to do most of those things pretty much all week. But then you have that week where you have a bunch of weekdays off and you can do things with your family and support your wife to do her goals. And that's a big positive for sure.
Yeah. Again, mindset and being purposeful. So when you're working that weekend that really sucks and the weather's great and people are out doing fun things, maybe it's a holiday weekend, maybe everyone else is doing super fun things. That moment it's hard, but remember to the times where like, oh, I had those other days off and I got to do things that my friends who have 9 to 5 jobs can't do.
Yeah. Is there anything recently that's happened that's made you proud about your career choice, proud to be an ER physician?
That should be easy to answer. I guess I'm going to have to think about that one for a little bit.
I'll answer first then while you think about it.
Yeah.
For me, the most rewarding cases are the ones where we work a lot as a team with the physicians as PAs in the ER. And, there's lower acuity patients we manage on our own, but I get more reward sometimes for managing a patient that maybe has an unexpected result. They have acute appendicitis, right? We check tons of patients for that. A lot of them don't have anything. But managing even just an acute appendicitis completely on my own, consulting surgery, getting them set up to go to the OR, doing that completely on my own is kind of rewarding. Even though it's a simple case, I'm like, this patient had a real emergency and I handled all of this completely without a physician. They didn't even need to see an ER physician to get the best, highest quality care possible in the ER. Or patients where we find incidental stuff and the specialist is great and comes and sees them at the bedside and they get expedited care for a cancer that needs to be excised sooner rather than later. And things like that are kind of the most recent stuff I think that's been rewarding for me. But yeah, what you got?
So I'm gonna answer this in somewhat of a roundabout way, but bear with me. What I find frequently rewarding, recently, but also frequently rewarding, is when I'm not at work. It's very career related, but when I'm not at work. So you're the neighbor, you're the brother, you're the family, you're the relative that knows about medicine, right? Like, people look up to you and they call you with questions, and most of them apologize, sorry to bother you, but like, how rewarding is it to know that like you're the one that people go to information about the most personal things? And I don't mean personal of like embarrassing. I mean like just physical symptoms of any kind is highly personal to people. You're the one that they go to. And as an ER physician, people oftentimes think I can just like do all these things. Like, oh, if there were a car wreck, you could just like pull off the side of the road and save them. Like, no, I can't. I mean, if I don't have an airway and I don't have an IV and I don't have medication, I don't have blood, I don't have tools, there's not
You don't keep
lot.
a bunch of C-collars stocked in your
No,
car so you
I
can
mean,
immobilize C-spine.
in the field, you can put a tourniquet on and you can give like epinephrine for a life-threatening allergic reaction. And that's like it. As far as like life-saving things, you know, even CPR, how long are you going to survive on the roadside doing chest compressions with no defibrillator and no ventilator? Not very long. So what I find highly rewarding is alleviating people's anxiety. And that paradoxically is one of the more frustrating things at work, when you go to work and you want to do all these cool things, but you're found telling people not to worry, and you really have to explain to things a lot, and they're clearly very anxious, and you find that frustrating. Like, honestly, and outside of work, that is super rewarding. Like, I have neighbors, I have friends of my wife who text me, call me, some people more frequently than others, but I take a lot of pride knowing that like the best thing I could do for them frequently is nothing, and telling them they don't have to worry. They don't have to pack their child up at 2 a.m. and go to the emergency room. They don't even need to go to the emergency room at all. This is fine. This is normal. And just to see and hear like, oh, thank you. You didn't do anything. You told them to do nothing. You did the opposite of what people think.
Yeah.
They came to you thinking like, oh, my kid needs stitches. My kid needs a CT scan because they hit their head on the cabinet. They need all these things. And you're doing the opposite. You're saying, no, they don't actually need anything. And that is really rewarding, to be able to like alleviate people's anxiety, give them a peaceful night's rest, let them know their kid is okay. And you don't know how impactful that can be. To you, it's just like, yeah, don't worry. Your kid doesn't need a CT scan because they just kind of hit their head on the cabinet and they're acting a little off, but that's fine.
Yeah.
For you, that's just like a sentence and you're done and you don't even think about it. But for someone else, that may change their entire day. They may be happier at work. They may be able to sleep better. They may be less irritable with their friends and coworkers and spouses. Like, you don't realize the impact of alleviating anxiety.
Yeah. They let their kid go to sleep instead of keeping them up all night.
Yeah,
like, don't fall asleep.
The cascade of good things coming from anxiety alleviation and saying, you are okay.
Yeah.
Things are going to be okay. Everything is fine. That's powerful.
No, I love that. I don't think anyone's ever really talked much about that, but that's a great point, because I mean, all of us that are clinicians get those text messages from family and friends. And I mean, I can think of a bunch of scenarios where I'm like, please, you do not need to take your kid to the ER. They can go to bed tonight. This is not something that warrants a CT. I mean, we do that stuff all the time, and that is really rewarding, because they think they're being bad parents if they're debating going to the ER. And I'm like, there's nothing that the ER is going to do for you. Keep an eye on your kid. They're going to be fine. You don't need to waste 10 hours keeping your kid up all night going to the ER. And and you're right, it saves so much for them, just the peace of mind and then the time that they're saving by not having to go and wait in an ER for something that doesn't need to go to the ER. That is the majority of what I do, I think, with friends and family, is like, you don't need to go to the ER for this. And then the occasional, you probably should go to the ER for this. But
exactly. That's equally rewarding and important, though a lot less common. Saying like, don't ignore that.
Yeah.
That means something.
Yeah.
Go get it, make an appointment soon.
Yeah.
You know, take care of that or do something. You know, another example recently, I had a family friend who was diagnosed with pretty big pulmonary emboli, bilaterally. She's okay, but she was very concerned about it, understandably so. She's young, she's healthy, she spent a couple days in the hospital, and then is discharged and like, all right, I'm on blood thinners, I have this, I have that, how do I balance out chest pain and shortness of breath and what's worrying and what's not, and, you know, freaking out. So that's the opposite, where I'm like, okay, this is important, this isn't important, rather than just saying don't worry about it. It's being able to give her all of this information and saying like, if you have a question, you know, call me, text me, whatever, to help guide them and navigate them through things because of the knowledge that you have that average people don't.
And it doesn't bother me. I don't know how much people in the outside world think it bothers us, but I would much rather you send me a text message about something you're worried about than, well, let's just go to the ER, let's go to urgent care. I would much rather you ask me first, because I might be able to save you a trip. Maybe I can't and you still need to go in, but I would much rather get that message, especially from people I'm close to. I'm like, please just send me a message. I'm happy to talk about anything you're worried about, so you don't waste your time and your money going into the ER for nothing. Or, you know, the opposite, and say, yeah, you should go to the ER for this, you know, but it never bothers me, you know.
I don't know that I've ever had a family or a family member or a friend or a neighbor not say, I'm sorry. Usually they start out the conversation, I'm really sorry to bother you, but, or they ask their question and you have your conversation like, okay, I'm really sorry to bother you. And I'm like, honestly, don't be. Like, I don't think people understand that genuinely actually makes me very happy to be able to help someone without doing something heroic. Like the field that we are in values this drama, all these heroic, crazy actions that make for wonderful television. But it is equally rewarding to have simple wins. So when people ask, I like it, actually. It doesn't bother me. I'm very happy to help.
I'd much rather get the message before they waste their time and money. I mean, ER visits are expensive. If you have health insurance, it is not cheap. So I'm like, if I can save you some time and money, like, please text me.
I think a lot of people don't understand how medical providers in our setting do like to help our close ones.
Yeah.
And a lot of times helping them is not doing anything. It's just talking.
Yeah. I mean, that's what we end up doing in the ER a lot anyway, is just reassurance. You know, we're pretty good at figuring out the cases that are non-emergent, you know, and so we can do that over text a lot of times.
Yeah, that you know, there's an old saying like, don't just stand there, do something. There's a brilliant mind in emergency medicine who always said, don't just do something, stand there. And it's a play on words, a play on a saying that means like, you don't always have to physically be doing something. Sometimes just stopping and thinking and talking is the only thing that's needed.
Well, it turns out if you don't have something life-threatening or emergent, we're probably more likely to harm you than to help you. I mean, all medicines have potential side effects and complications and different effects. And if you don't have anything really wrong with you and we give you medicine for it or try to do something aggressive, it's more likely to harm you than help you. And so you're right. I mean, often doing nothing, if something doesn't warrant an intervention, is the safest thing to do for that person.
Yeah, just, I guess, for example, being admitted to the hospital is the perfect way to change something. So that means if you're sick, you get admitted to the hospital, it's a good place to become well. If you're well and you don't need to be in the hospital, the chances of you getting sick are actually pretty high. Whether it's catching a virus from all the illnesses that are in the hospital, or just not moving for a day or two and becoming constipated, or worse yet, developing a blood clot in your legs or something. Like, if you're well, you might become sick. If you're sick, you usually become well.
Yeah. I mean, even something as simple as an IV is not always benign. I mean, you can get a superficial clot in your arm from that. I mean, if you don't need an IV, you don't need an IV, and it's more likely to harm you than to help you, you know? So it's, every little thing we do has potential side effects. And I don't think we always remember that we don't always have to do something to help people.
Mm-hmm.
A lot of times it is just reassurance. Well, I don't have a lot more stuff I wanted to talk about. Did you have anything specific in mind?
I think I covered most of the things. A lot of the things are obvious. Taking care of yourself, being healthy, that's obvious. Being intentional, being purposeful, being like practicing gratitude is important. And I really am a firm believer in maximizing your relationships, whatever those are for people. Take care of your relationships, cherish your relationships, do not be a lone wolf. Lone wolves die.
Mm-hmm.
Wolves that accept help from one another and work as a community, those are the ones who thrive. And humans are also the same way.
Mm-hmm.
So in your journey in a career that is very difficult, very challenging, easy to burn out, easy to ultimately dislike one day, the rewards on the other side are that much more magnified.
Mm-hmm.
So how you experience that is a lot more in your power than what you think. You're not just a victim to work and the political environment and all the things. With the right mindset and the right decisions, you can drastically change how rewarding your career is going to be, and the kind of person you're going to be to your spouse and family and friends. You can't really separate that. I don't think. Some people think they can. I don't believe that is you can get by that way, but I don't think that you can be optimal. I don't think you can be in your best unless all of these things work together at the same time.
Mm-hmm. Focus on the things that are within your control. There's so many things about our work-life balance that aren't in our control, but there's a lot of things that we actually have influence over. Our mindsets, taking care of ourselves before we go into work, maintaining your relationships and social network and all that stuff is within your control.
Yeah.
You know, we can't control what the government's doing, what the hospital systems are doing, but there's a lot of things we can control.
And I'm just as guilty as everyone else. I have got to frequently stop, reset, tell myself, hey, get your stuff together.
Mm-hmm.
You know, I am not immune to that.
Yeah.
But for those of us who are in emergency medicine, paramedics, EMTs, nurses, techs, scribes, doctors, PAs, NPs, environmental services, whatever it may be, this setting is an amazing setting. And you do genuinely, whether you believe it or not, whether you realize it right now or not, you have one of the coolest jobs in the whole world.
Yeah.
Appreciate that, because not everyone gets the opportunity like us to be in this field, to be able to help people. Like, what other field is there where you see people on the single worst day of their entire lives? Not very many. And definitely people don't really want to see people on the worst day of their lives, but like, take pride in that, take honor in that, touch a life, and allow other people's lives to touch you.
Yeah. It's so easy to lose sight of that. I mean, like you said, I'm not perfect at any of this stuff. It's something you're constantly having to remember and work on. And for me, just remembering the honor that it is to be there on someone's worst day, you're like, you kind of forget that sometimes in the busyness of life and work. And you're like, this job is really an honor, and not everyone gets to do it. So, I mean, it is really special that we get to do it.
Yeah.
I'd say I would reiterate too the intentionality behind remembering the positive too, because that's super easy to forget in your busyness of your day, and it's your brain naturally is going to gravitate towards all the negative. There's plenty of negative throughout the day, but there's also plenty of positive. You've got to figure out some method for getting that in your long-term memory and appreciating that patient. I think that's really key to avoiding burnout too, because there's plenty of positive interactions you have, and your brain naturally wants to let those go quicker than the negative. So whatever you can do, take a couple deep breaths and remember that patient that you had a great interaction with will help put that in your long-term memory, so that at the end of the day, you're like, there was some really cool people I got to talk with today, and people that were really appreciative. And, I think that's really important too.
Yeah, I agree. It definitely is.
Cool. Well, thanks for your time, Lucas.
Yeah,
Appreciate you
it's always a
coming in.
pleasure, Aaron. Thanks for having me again.
Yeah, absolutely.